Good morning, and I hope you all enjoyed the cocktail yesterday evening and the evening in Vienna with so many beautiful places. So today we will have a full day to continue our journey. And our journey today will be on infection prevention and control, antibiotic stewardship, and awareness raising and communication. But we will start the day with a keynote presenting an international perspective. And I'm delighted to welcome Xavier, Teles Canavilhas. Xavier is a member of the Quadripartite working group on youth engagement for AMR. He will talk about essential visibility, how making veterinary work visible changes AMR response. Thank you, Xavier.
Good morning. First of all, thank you so much for this opportunity to talk a bit about what has been my journey so far in my career. And so I've prepared a little presentation for us. Just any moment now. And so my presentation, so it's focused on essential visibility, which has been something that I have been devoting the early parts of my professional journey. And so we know that AMR is the defining cross-sector health threat of our generation. We know that the science is clear, and we know especially that AMR is something that we can only tackle with a One Health attitude. It is not something we can tackle individually, but we are still disconnected. And my question was always why, ever since I was a student. And that basically formed the thesis for my professional journey, which is that the contribution of veterinarians to public health needs to have this essential visibility. And this visibility, it's truly a barrier. I believe in public health as a whole, when things go well, it's practically invisible, right? Because we cannot see an outbreak that didn't spread, we cannot see a pandemic that never started, we cannot have a food shortage that never reached the supermarket, and so public health in its spirit, it's invisible. And I believe that veterinary public health is one of the most invisible of all. And so when we have work that is invisible, we lack recognition and acknowledgement. And if we lack that recognition and that acknowledgement, what we also have is an undervalued profession. And being in an undervalued profession, what that means is that our contribution doesn't have the resources that it needs, doesn't have the weight, the influence in health policy that it needs to be able to defend its own work and to be able to keep on doing the work it needs to be done. And what this sums up to is basically siloed systems, which are basically the systems that we work in. So systems that live in isolation, that achieve and fail in isolation, and those systems don't allow us to have a coordinated and effective response to AMR, no matter how strong the scientific evidence we have from it. And so, for me, this really opened a two-pronged response to invisibility. The first one with connection, and after that with data, because connection is basically starting the conversation, but then we need to have something meaningful to say, and that is where data comes to play. And so, starting with connection, as a student, we started in the Portuguese Federation of Veterinary Students, we participated in building and founding the National Health Students Forum, basically a forum that gathered students from all health professions, so nutrition, medicine, human medicine, veterinary, pharmacy, psychology, among a lot of others, in order for them to understand the role that, that all of them have in the bigger health scenario. And that was very powerful because when students have this connection and start to do this work and start to learn about other professions, it's way before they crystallize in their professional identity. And so the barriers that we face further down the road aren't set yet. So basically what FNESH has been allowed us to do is plant the seeds to then harvest them later. And we did harvest them with the Young Health Professionals platform further down the road, already graduated. And we started this platform more towards policy and advocacy, knowing that we together could achieve a lot more than separate. And so with that, we started preparing and working on political visions, in this case for the Portuguese government, on how health could be discussed as a whole with all professions on the table, because I believe the table of health is quite long and large enough to fit us all. And from there, I have been also very honored to be integrated into the cohort of the working group on youth engagement in AMR from the Quadripartite. And this has been also a very grateful experience, because what this group is basically doing is just trying to tackle all of the best examples that we have found in terms of AMR youth engagement and giving them a global platform integrated within the Quadripartite structure. And just to give you an example, because we do not have to participate, of course, in every discussion, but if we are present, we can have something to say. We can learn from each other's mistakes. We can translate knowledge from one area to another. And that is exactly what happens in the Young Health Professionals platform. So just last year, we've presented 5 different action papers to the Portuguese government, focusing from career and work conditions in the National Health Service to health literacy, to One Health. And so this perspective on health really has a political significance, because even though, of course, it's a young health professionals platform, so it combines young associations and representations of young professionals, when we have a common voice is very interesting to the political and policymakers, because basically a lot of the discussion was already made, a lot of the compromises were already identified, and a lot of the strengths and weaknesses have also been identified. And so, but of course, as you know, connection and starting the conversation is not everything, so we need to have something meaningful to say, and that has been the second part of my professional journey, which has been data. And I truly believe that data makes impact visible and makes veterinary work visible. And so when I was just finishing my veterinary degree, I had to do something for my master thesis, and I had these questions in my mind that were, how can we make veterinary work visible? So not only to other professions, but to veterinarians as well, because if they cannot see their value, they cannot pass it on to anybody else. How can we demonstrate with evidence the real value and impact of what veterinarians do daily? And also, how can we give it significance and scrutiny? Because without scrutiny, there isn't any way to be able to improve on the work that veterinarians are doing. And so for these questions, I thought that maybe a good answer would be to try and develop an electronic prescription system that would be able to not only create data, but to give scrutiny, give significance, and most of all, to have also a common voice, a common denominator for all veterinarians. And so I was 23 or 24 years old, and I tried to book a meeting with the Portuguese competent authority, the GAV. I had a presentation and a little PowerPoint, and I was very excited to present, and I told them my ideas, and I had a lot of schematics and graphics to show them. And I did the presentation, and I came back home, and I just thought, this is completely crazy. No one in their right mind is going to let someone try and do this. But much to my surprise, the Portuguese competent authority said, let's build it, and they were immensely courageous, and I'm very grateful to them for it. And so with that excitement, we built PEMF, basically the Portuguese electronic prescription system. And from the beginning with PEMF, we had some key objectives. We wanted to cover all kinds of prescriptions, so not only electronic prescriptions, but manual prescriptions as well. We wanted to cover not only prescribed medicines, but also administered medicines and dispensed medicines. We wanted to cover all species, all clinical contexts. We wanted basically to have a system to close the circle completely. And so that is what we did. And with that, we were able also to get clinical context out of these prescriptions, because we have the diseases, the production stage of food-producing animals. We have, if it's a prophylactic or metaphylactic use, cascade, the use of cascade. And so we have a lot of this clinical reasoning present in our data in the electronic prescription system. Another thing that we wanted to do is have supply chain integration. So we wanted to know if a prescribed medicine went up to the pharmacy and was sold, because we needed to know the compliance in order for the data to be significant enough, because we cannot take outcomes of that data if we don't know if that medicine has been effectively at least bought, if not bought and administered, and when and how and by who. And so we integrated also pharmacies, distributors. We integrated all of the chain of medicine, so all of the alterations, all of the market authorization that were granted. Everything is connected in the single system, so that all of the data is related, all of the data is structured, and so we can truly take some insights out of it. And with this system put in place, what we have is records from individual animals to farm records that are very detailed and that have this granular ability, so that we can also have the potential to do targeted interventions. And of course, as well, outcome tracking, as I've spoken. And with having all of this data structured and reliant on what is European data strategies and European controlled data by the EMA, we have this system also prepared for interoperability at the European level, not only functionally, but also in terms of reporting. And that is something that has been also very good in terms of resource use. And just in 2024, so 2 years after the launch of the electronic prescription system, we have already just in the year 2024, sorry, we have 17.1 million animals, food-producing animals, that were treated, more than 1.2 million packages prescribed. On the side of companion animals, more than 235,000 animals treated during the year of 2024. But what really makes us proud is how we can effectively measure things that we weren't able before. So we can see that we have been reducing a lot of the prophylactic use in terms of the use of antimicrobials, especially in swine, is something we can see over the years. We can also see that most prescriptions most antimicrobial prescriptions are in the lowest risk AMEC category. And also, we have been able to use much of this data for targeted interventions by doing disease clusters and by understanding exactly how these diseases are spread, what's their regional context, what's their farm context, among other things. And because we cannot have such a seismic change, right, in the work that veterinarians do without giving something back and without creating value. Because if we are adding another task on top of whatever work clinicians have already to do, we cannot drive adoption. We cannot drive adoption. People are going to resist the system, are going to try and find ways to counteract it, to go around it. And so what we really tried was also to not only bring value as surveillance per se, but also as a tool, a clinical tool that veterinarians can use and that can bring them value and increase their value as health professionals. And so today, in just, I would say, 15 seconds at the point of care, veterinarians can have access to this complete treatment history. So all prescriptions that were prescribed for a given animal, medicines administered, diagnostics that were made, now is something that they can see without any information gaps, without needing to ask the owner or the producer one more time about exactly what happened. They can see and they can recognize some disease patterns that was something that they weren't able to do previously. They can also see how their prescription or how their clinical approach will be effective or no, or at least they can infer from the experience of other vets that came before them and handled something similar. And so with that, we can also compare outcomes. And that is something that we, in an electronic system with big data mindset, can do, is we can extract value from just collecting all of this data together in a structured manner and make it so that this value, it's not only visible to regulators, but also to veterinarians as a whole. And so this, of course, leads to better stewardship and more value to the professional. And currently, what we are now trying to achieve and working on is using this data, using resources like machine learning to create models and develop models that can give us some more insights into the data that we already have. So we are trying to basically create models to predict the risk of zoonotic diseases, such as individual risk variables, but also trying to see what patterns emerge on early disease so that we can have targeted interventions before there is a widespread AMR risk, of course. Another thing that we have here is you can have a time series analysis of patterns of prescription that we can then use to correlate with analysis on antimicrobial resistance and see if we can identify any patterns that we know with a certain degree of certainty that will probably lead to the emergence of some resistance. And also in more of an exploration, let's say, kind of work, trying also to detect patterns that at multiple dimensions that can also help us be more effective and have a better use of our resources. And of course, this means for regulators that we can optimize resources, that we can have early warning systems with risk prediction, and that we can have evidence-based policy interventions, and especially we can have a proactive risk mitigation. And we can truly say it's proactive because we're all under the same platform. And so these insights can go directly into the vet. When he's doing a prescription and is choosing a desired antimicrobial, if we have some insight that we can share with him or her, we can basically try and mitigate this risk even before the prescription even has a unique number. And so this is something that also adds value to the veterinarian, improves the clinical outcome, and allows us to have a common understanding of how this data also is used and the value that is created, and also, of course, allows us to have a better adoption rate and a better compliance rate with the prescription system. And so why we need them both together? Because not only because they amplify, but because connection alone is, of course, is important, and case-by-case collaboration works, but we cannot have a widespread success story. We cannot have a widespread behavior change, and we cannot measure collective impact. And so if we cannot measure collective impact, we don't have as strong of an argument for health policy. But if we have data alone, of course, we have that data set, and that has its value for certain, but there isn't any demand for this data. And that is a big concern. And so if there isn't a demand, why do we have this data set, right? If we have this power in our hands, but no one is asking for it, nobody is open to it, what's the impact of it, right? And so for me, at least, I believe that only with data and connection, the same as starting a conversation and having something meaningful and impactful to say, we can, only with them together, we can really achieve some transformation. And I believe as scientists that we all have sometimes an attitude towards connection and improving those connections, that it's not real work, or is it not something sometimes that we value immediately, but it is something that opens the door so that when we have meaningful data and when we have meaningful impact, the doors will be open to us for us to share the value that we contribute to public health as a whole. And so in this transformation, we can have the conversation and the thing that is meaningful to say. And this is what I've called essential visibility as a foundation for AMR and this One Health attitude, which is when the work is visible, the work is recognized, is acknowledged, is valued. And if there's valued, collaboration occurs. If we break this cycle, that we have now of siloed systems and undervalued professions, we can extract value from other areas that so far have been just living in isolation. And so with this professional dignity, with the evidence-based collaboration, we can truly achieve a behavioral change at scale. And I believe that AMR is actually, of course, a challenge, but it's also an opportunity to really make One Health concrete and something that one day will not be innovative at all, will not be new at all, won't be a buzzword, will just be something that is inherent in any one of us as a collective identity as healthcare providers. And so just to share a bit of this Portuguese experience on my perspective, for us, we now have this unprecedented veterinary data infrastructure. We have more than 2.5 million prescriptions that were prescribed by the electronic system in just this 3-year period, but actually it's turning 4 years old on Saturday. looks like a child, sorry. And we have young professionals that took the challenge and are working across sectors naturally. We have evidence that demonstrates this impact on population health, and we have EU-level interoperability. However, of course, we still have a lot of ongoing work, a lot of challenges, because cross-sector data sharing needs advocacy and needs people to stand up for it. There is still a lot of connections to be made in terms of hierarchies and leadership and policymakers, and of course this kind of scaling truly needs political commitment, and for political commitment, as we know, we need public engagement. So our key lessons, it's basically just we need to build this visibility on all levels. We need connection and data and organic development. So just taking the step forward is the best lesson. It's the best guidance that we can have. And of course, it takes a lot of time. It takes a lot of effort. It's very hard to break down these silos. It takes a lot of sometimes even courage to step into rooms where you are absolutely side-eyed, but we need to take that courage for our generation and for the next ones. And so, just to finish, the lay of the land in Portugal, we started from this contribution being invisible to some interesting data points and to having this progressive cross-sector collaboration that we foster and we value very much. And so, just to end, I would like to say that even though I'm a bit idealistic, I am not that naive, and so essential visibility doesn't solve AMR. So sorry for ruining the first 25 minutes of the morning. But yeah, thank you very much. But I'm absolutely certain that without it, we cannot solve AMR. Thank you very much.
Thank you very much.